Dr. LeBlanc, a person has a silver filling or amalgam filling, as is probably a better word for it. And lots of controversy out there, good, not good, bad, all that stuff. And we touched a little bit on it. But give us some, questions the patients should ask but never do ask about those silver fillings and what should happen.
Right. Thanks for asking that. To me, that's one of the biggest things people have that they're unaware of because they don't hurt. But not a day goes by that on our schedule I don't see BT, and that stands for broken tooth. And I know what I'm going to find 99% of the time. A big silver filling with half of the tooth broken away from that silver filling. The silver filling's still in there. So as we touched on before, the silver fillings with the mercury in them, and it's about 50% mercury. The mercury expands and contracts. Think of a thermometer with mercury in it. It expands and contracts, and it cracks teeth. That's why people are breaking teeth. So if someone comes in with 5 crowns, I'll look at 1 or 2 silver fillings they have left and say, you really should get those out of there. And I say, these other 5 crowns, I wasn't there when they were done however many years ago, but I guarantee you they all had big silver fillings. And they go, oh yeah, I remember it had a big silver filling and a piece of the tooth broke off. So we can wait till it breaks off and needs a crown and sometimes even a root canal. My recommendation, and I get stronger and stronger about this as I see what I find under all these silver fillings, is get them replaced. So getting back to your question, how do we replace them? If they're not too large, we simply put a composite filling. Most people know of a composite filling as a bonding or a cosmetic filling because it's tooth colored. They look great. But more importantly than tooth colored, this is space age stuff. It bonds to the tooth. As opposed to the mercury filling trying to break the tooth, it literally helps hold the tooth together. And it's easy. The scientists have done a great job over the last, I'd say, 15 years on developing some really high-tech filling materials. If the silver filling is a little bit bigger, then we will go with an inlay or an onlay. We can do those here at Portola Dental in the same appointment oftentimes because we have the computerized crown making machine, which also makes the white inlays and onlays. They're very hard. They're bonded in. They strengthen the tooth. It's just a fabulous way to go, and you're much less likely to have breakage problems in the future than to go on and just leave these silver amalgam mercury fillings continue to do the damage of the teeth.
So the damage of the tooth, as you say, is not so much because of the mercury poisoning, even though there might be something to it, but the verdict is still out on that to a certain degree. But one thing is for sure, the expansion and contraction of the mercury, which we all can understand does it. That's why we have it in the dermatitis, because it's so easy to responding to just a degree of temperature, will break the tooth. It's like filling it up with water. That's why water pipes burst. You fill it up with water, it freezes, it expands, boom, water pipe burst. So on one hand, it fixes something, and at the time that was the best thing that they could have. So it was a lot better than nothing. Right. But now that's why they should come up. And if it's not broken yet, thanks God, beautiful, and then you will decide of taking it out. Not all right. Anything else to that, or did we cover it?
That's pretty good.
Thank you very much, Dr. LeBlanc.